Hey, Tony.
All
Macaroni
right,
Tony,
fellas.
what it do?
How you doing?
Good.
Good. Dr. LaPere, we go ahead and you can go ahead and talk about yourself and kind of take what you specialize in and what you do, and then how I came in contact with you, and then I'll add to that. Tony also is an individual who has had a prostatectomy as well. He had his in March,
hmm
and he was back on stage competing. When, Tony? Not November?
I did a show in August.
August. Okay. Go ahead, Dr. Pierce. Dr. LaPere.
All right. Well, I'm Dr. LaPere. I am the physician and the owner of the refinery here in Murfreesboro, Tennessee. We specialize in both medicine and aesthetics. The big thing on the medical side that we do is hormone replacement therapy for guys and girls. And then I do something that is a little bit unique called performance enhanced health monitoring. So for individuals that are using performance enhancement drugs, or they are supplementing their workouts with something that's not being prescribed with a doctor, to make it as healthy as possible, we do blood paneling. I meet with the trainers in addition to the athletes in many instances. We go over the regimens that they're doing. Then we also go through each individual prep phase. So if they're doing a bulk versus if they're doing a cut versus if you're in the off season, checking to make sure that each one of those individual prep phases didn't do too much havoc on the body. Just because you guys are pushing your body so hard, sometimes things can get a little bit out of whack when you're going into a dehydration stage at the end of your cut versus when you're going into a bulk and you're really taxing your liver because you're putting so much food inside your gut. So I've been open about 9 months now. I did my first prep trying to get ready for a competition back before COVID started. And when I started getting into this world, I started noticing, unfortunately, that there were some pretty big names that were passing away. And I'm 45 years old, and they were around the same age, 45, 50 years old, and it seemed like it was bam, bam, bam. We lost people pretty quick, all from things that I felt should have been caught relatively early. But the people just don't have a trust for the medical community. We had a big hit with COVID and with the CDC and all of the information that was being shot out around things like that created distrust. We had people passing away from that. We had people passing away on stage. Most time when a person goes to a medical doctor, and if they are open enough to sit down with them and say, I'm running this particular gear or I'm doing this particular thing to my body, unfortunately, a lot of times the doctor's answers will stop doing that. And that's just not appropriate. This is y'all's livelihood. I respect what's going on. I've went through that prep, like I said, so I know the sacrifice that's going in to try to get ready for these shows. And it doesn't matter what type of things you're putting in your body. If you're not putting that work in the gym and the work ethic, it's not going to happen. So we got doctors out there that when we have people that are addicted to Percocet, they'll give them Narcan in case they overdose on Percocet. But then I got people that come in that are literally working to be the most healthy version of themselves. And I got doctors that are telling them just stop what you're doing and go away. Whereas all they really need to do is a little bloodletting, check a PSA level, check their CBC, look at their liver function. Maybe I need to adjust the blood pressure medication or two. You guys are doing all the work to stay healthy. There's just a few tweaks that if the people don't have a trust for their doctor or for the medical community, things can get out of hand really quick. Something as simple as your blood gets a little too thick because your testosterone is running high. Next thing you know, you got high blood pressure. Then you got cardiomyopathy because your heart gets too big. And then you're 47 years old and you're passed away in your sleep. So my goal is to end that. I don't want that happening anymore. I respect this sport. I'm going to start a prep again with my coach in January to try to get on stage, hopefully get up to y'all's level someday. But people have to be healthy. People have to have trust in the medical community and have someone that can look out for you and do things from a smart perspective so that you can stay in this sport longer.
Good deal. Coach, let's talk about you for a second. Introduce yourself, and Tony, you can do the same, and I'll go ahead and give my testimony. And Tony, you can also share your journey as well.
Well, as y'all know, I'm Anthony Jokes, two-time Olympian, going in my 4th year as a pro. And been competing for like 6 years now, did a number of shows. and also became a coach the last 2 or 3 years, and just learning other athletes' bodies as well as mine is but coming from the background of my last coach and all my experiences, I've been big on, getting your blood work, getting your physical in, you know, it's important because I've been sick before, and then trying to run through prep being sick and not paying attention to the details, which was right in front of me. Like, I can work out all day, but if your insides is not going well, then it doesn't mean anything. And now that I realize, and I want to pass that on to also the people who I coach and stuff like that. And that was like the first thing, me and Ivy always hit was like, how you feeling? How's the body? Are you taking this for this and that for that? You know what I mean? So.
All right, Tony, introduce yourself.
Well, I'm Tony Lynch. I've been IFBB Pro since 2015, and kind of my journey, I love to compete. I love the environment. I love the camaraderie with everybody, and so that keeps me close to the sport. And really, I got into it for health reasons. Didn't like where I was going, and I really just wanted to get healthier and lose some weight. And quickly I won some shows and got addicted, and 6 months after my first amateur show, I got my pro card. So I've always been really attentive to my health, and really wanting to change and upset the path of history with my family. A lot of the males in my family really didn't live past 50. It was that people were dying early. The women would last longer. They were a little bit healthier. And so I wanted to pay attention to that so that I could live a long life. So fast forward to 2017, my father, who very athletic, always been in sports, he got prostate cancer. And by the time they found it, it was already stage 4. And so it metastasized and got in his bones, and he passed in 2017 from that. So knowing that I had the hereditary history, I knew that I was probably statistically going to have to face it at some point. Didn't think it would be this soon. I'm only 52 when I got diagnosed. I'm 53 now. And pretty much in February, I was told I had a pretty bit of cancer in the prostate, and that my options were in front of me to, kind of do either radiation and chemo, but based upon my age and, projected life expectancy, the doctor said, if I was you, I would want to just be behind it. And I agreed with him, and I opted for the prostatectomy in March. So I was really looking at my blood work and looking at really just the markers that will give us an indication that prostate cancer is there, just because I was paranoid about it because of my father. What was really unreal about this whole process, my PSA really didn't get extremely high. It was about a 1, stayed about a 1, and then it elevated from a relativeness to a 4. But if you look at a 4 on the scale, that's kind of at the low end of worrying about prostate cancer. And the in-office test to see if there was any growth, that was negative. But because of the history, they said, asked if I wanted to get a biopsy. And I said, well, heck yeah, I want to know. And so I'm so glad that I did, because, I was a stage 2 when they first diagnosed it from the biopsy. With the pathology that came back, they actually advanced it because it was a little bit outside the prostate, and it was a stage 3. So I'm blessed that they were able to find it. Technology today with the robotic surgery, I was back in the gym 3 weeks after the surgery.
Nice.
Yeah, that's a blessing within itself. My whole situation was, one thing about me, I read the Bible every day, every morning. I spend time and I read it at night sometime too. and I spend time reading, to kind of get a better relationship or strengthen my relationship with God. So the way I came in contact with Dr. LaPere was this. There was a gym here in Murfreesboro, Tennessee by the name of Carbon Culture. That's a gym that I visit every now and then. So I had already worked out one particular day, and then they were having an open gym. And so I happened to go by there, and James Yates' wife, who's the co-owner of the gym with Brandon Curry, she was like, well, we have a doctor here. He does blood work. But mind you, when I was getting my blood work done, I was driving probably 45, 50 minutes to another doctor. So I went over and started talking to Dr. LaPere. I think we may have talked for about 30 to 45 minutes. I found some common things. He gave me his card. I set up an appointment. I went in, got my blood work done, and I had signed up to the quarterly plan, right, Dr. LaPere? I signed up with the quarterly plan where I can get my blood work done quarterly. And then from that point on, my PSA level was elevated. And Dr. LaPere said, that's concerning. He said, that's concerning. So, of course, I'm asking questions. What does that mean? He was basically telling me in a nutshell what it meant, but that wasn't his specialty. So he referred me to Dr. Johnson, a urologist, who I had to go and see from that point. So we did a blood panel with him, and my PSA was my PSA was a 14, but over the amount of time that I had waited, it had gone from a 14 to 14 point something. So it kind of elevated a little bit more within the little time frame that I was waiting to get my blood work back. So, not get my blood work back, but from the time frame, I guess from Dr. LaPere, and then going to see Dr. Johnson. So I went in to see Dr. Johnson. Dr. Johnson stated that, my blood PSA is elevated. He said that's concerning. He had did a DRE, and the DRE was normal. So from that point, he scheduled a biopsy and a ultrasound. The ultrasound was normal. The biopsy came back and it revealed that I had prostate cancer. So mind you, I'm still praying. So when he hit me with that, of course, that's kind of gut wrenching to hear that you have cancer. But he broke it down, and what was actually going on. During the biopsy, he took like 12 pieces, I think 6 pieces on each side. And one side I was a grade 2, and the other side I was a grade 3, and grade 5 would be the worst. So once we got to that point, he said, okay, the next step is to do an ultrasound, do a MRI, and also do a bone scan. So I had to wait, I think maybe a couple of weeks to get that scheduled and got that done. And during that time, I happened to be reading the Bible even more. I was reading about the crucifixion, and I was praying that I knew that I had prostate cancer, but I was praying that it was still inside of my prostate. So that was my prayer. So when I was reading about the crucifixion, I had dreamed that I had touched the piercing in Jesus' hand and also in his side. And then a feeling came over me that I really can't describe. But I woke up and then I was like, man, this is going to be a good week. So going into having to do my bone scan I think was on Tuesday, and my MRI was the following day. So I'm sitting in class teaching my last period of class. Of course, as things are running in my mind, I'm trying to not think about anything negative and avoid from reading certain things. My kneecap started to ache. It just started to ache out of nowhere. So now, man, I'm thinking, what if there's something in my bone? And I just, kind of prayed and just rebuked that thought process. And then my knees stopped aching. So to fast forward to the next day, I went and got my bone scan done. And then the MRI the following day came back and got the results. But during my journey, God had already told me in my heart, it's going to be all right. Everything's going to be okay. So when I got the results of my bone scan, the bone scan was clear. The MRI also came back clear. So he basically stated that the cancer is located inside of my prostate. While he was going over the different options, and we were we were doing research, I had already came up with the conclusion that I wanted to get a prostatectomy. You know, I wanted to get it cut out, you know, especially since it hadn't gone anywhere, and I just deal with the side effects, you know, from that point. So I felt really good, you know, about my decision from praying. And mind you, no one really knew what was going on. You know, I don't recall when I even told Coach about it.
Mm-hmm.
So only one person knew. That's my girl Crystal. She the only one knew what was going on about it. So, and I was kind of torn whether or not I was going to share it with my mom. But my mom she's a worrier like most moms, but she prays a lot. So the day after the surgery, when I called her, I just basically told her about it, and then of course she said, "Why you didn't tell me?" So I said, "Well, Mom, I didn't want you to worry, but I know I was already covered under your prayer, so I was good." So that kind of softened the blow as far as, you know, her wrath of fussing. They helped somewhat, but it made it easier. I couldn't talk to anybody about it because I'm to myself. I don't really share a lot of things like that, and I was trying to deal with the best way I can, and also listen to God. And I felt that I am called to come on here to talk about, you know, health and awareness and getting your blood work done and getting your physicals done, because God blessed me to utilize bodybuilding as a tool to not only get myself together. So now when I look back at it, a lot of people look at us. You know what I'm saying? A lot of people, we inspire a lot of people one way or another. And if you look at me from the outside, everything looked fine. But lo and behold, there was something that was brewing inside of me in the form of cancer, which was on my prostate. So that kind of led me to where I am right now. Again, the surgery was on October 24th. I was blessed that it was successful surgery. Everything went fine. So from that point, the doctor sent my prostate to the lab to dissect it a little further to see what type of form of prostate cancer it was. Now, mind you, the entire time he was asking me, was prostate cancer in my family? And I was telling him no, because I didn't know of anyone who had prostate cancer. So to rewind a little bit, the day I talked to my mom after the surgery, I'm talking to her, and then she remembered that there were some people in my family that died from it. And it was my grandmother's sister's two sons. So both of them died of prostate cancer because one of them was stubborn and he didn't want to go to the doctor. He was self-diagnosing himself. He was basically saying, oh, he thought he had a hernia. So when he finally went, it had already spread it. So I'm a firm believer, you know, going to the doctor. You know, I'm not an individual who will put it off. I go to the doctor quick, fast, and in a hurry. So my whole point of coming together to talk about this is to bring awareness. First and foremost, get your blood work done. If you're here in Murfreesboro, Tennessee, please come and see Dr. LaPere. He is very thorough. He was very helpful in my process, and he's still helping me throughout right to this day. And I'm thankful that he came on here, you know, to talk about it. Dr. Johnson was unable to come over here and to talk. I guess he got a little busy. But all in all, I'm good. I think I'm about, 2 weeks back into the gym. Of course, as expected, you know, my strength is not where it needs to be, and it's going to get back there in time. Like I was telling Coach, I said my first time back to the gym, I was trying to do some pull-ups. I was only able to do 3.
Yeah.
And then my ego kind of kicked in a little bit. I'm looking around, see who's watching. And I was like, man, forget that. Forget that. I can, you know, I get back where I need to be, but I want to make sure that my health is need to be where it needs to be. So what I want to do is break the stigmatism of some as men. We have that macho in us. You know, we want to be macho, and we don't want to break down and go to the doctor. Guys, it's important that you go to the doctor, because going early saved my life. I'm blessed, you know, to not have any cancer, 100% healthy. I go back as a follow-up in February. My faith is strong. and my walk with God has gotten even stronger. So I'm gonna use this. I'm gonna allow Him to use me as a vessel to speak. Because when I spoke with Tony, I think when Tony and I talked, what, beginning of the week or last week, Tony? Yeah, we talked. And talked to some other people who were either going through it or in the or something was going on with them, and we kind of talked a little bit. Tuesday, so I'm sitting in the car getting ready to referee some games, and I'm looking at my phone like, man, Dr. Johnson's calling me. So my heart started beating fast. I was like, man, I thought I knew everything what I need to know. And he asked me how was I doing. I was like, I was kind of short. I was like, I'm good. Just to kind of get to what he was going to talk about. So he said, we got your results back from the pathologist where they dissected your prostate. And then I said, okay. Then the first thing that came out of his mouth was, he said, we have some good news. So I felt relieved, and I'm still trying to listen. He said, according to my DNA, I had the least aggressive form of cancer. So he said, that's good news. And he said it was slow growing, which is also good news. So I'm going to continue to get my blood work done. I'm going to go back and see Dr. Johnson in February. And then from that point, I'm going to continue to see Dr. LaPere. And Dr. LaPere also has, you also have the IV, the nutrient IVs as well. Am I announcing that correctly?
Correct. Yeah, we do multiple different IVs, everything from NAD to the IVs for nutrients. And then sometimes, during the prep, things get a little too crazy with the liver, and TUDCA is one of the things we use, and milk thistle is one of the things we use. But sometimes those two things aren't strong enough, so we have to use something by IV called glutathione. So I do glutathione infusions here to really try to detox that liver out.
So how often can somebody go for one of those IVs? Or how often should they do it?
So you can get, well, it depends on the individual needs, The glutathione is a great antioxidant. Antioxidants are great for just for cancer prevention in general, to try to keep those what's called free radicals, which are those cells that turn into cancer and they start growing out of control without the off switch. Most cells, as they grow, they have an off switch that'll just flip off when they've done their job. Cancer, the off switch broken. The way that you can try to stop that is you can try to give someone another free radical. So one of the other free radicals is ascorbic acid or vitamin C. But glutathione, that's one specifically to the liver. I actually do glutathione injections. I don't do the IV infusion, but I take 300 milligrams of that in the butt cheek once a week. So it just depends on what point of the prep you're in. If someone is in a prep and they're taking orals are much more difficult. I always try to tell people if they're going to be in a prep, they're on orals. Most people that are in preps are not drinking any alcohol. But one of the big things that I see that cause a lot of problems is Tylenol. They need to really be careful and not be taking any Tylenol for headaches or anything like that. It's most important that you take something like Motrin or Aleve or Naprosyn or one of those, as long as you're not trying to get all the way down to a cut to where you're dehydrating, because then those will actually hurt the kidneys. So that's why every time we change a particular phase, I like for the trainer to come in. We have a 3-way call after we get the blood work. I tell the trainer what's going on. The trainer tells me what part of the prep they're on, what gear, if any, they're going to be running. And then I discuss with the athlete. I get clearance from the athlete, because certain things are personal matters, and that's not necessarily always the trainer's information, their business. But I like for it to be a collaboration, because I learned a lot of things too. You don't learn about Winstraw and Anavar in medical school. It's been a lot of self-study trying to figure these things out. And they didn't even have peptides when I was in medical school. So I'm constantly learning. Most of my patients that come in here and the clients and people like y'all, you guys are constantly learning, because your body needs to be challenged and reworked every time you go into a prep. The prep that worked last year usually is not going to be the same prep that works this year. Your body's a year older, your shoulders are a little bit more sore, maybe your calves got a little smaller, whatever it might be. You know, every time you have to change something up. So just every time you change a particular cycle, it's important to come
So
in and get
just as
checked
the
out.
point of the athlete getting a coach, he should get like at least a personal doctor that covers. Like, how do the average, like, how can I say it? How can the average athlete find a doctor like you? Because there's not a lot of doctors out there who we feel comfortable with and actually know what we're going through. You know what I mean? So what, it's just like picking a needle through a haystack, or
Right.
just what's your opinion on that?
I mean,
Got you.
I'm trying to change that, you know, but some of my people, my fellow colleagues, they still look at me like maybe I'm the black sheep on things. You know, why am I encouraging these people to do steroids? I'm not encouraging anybody to do steroids. I'm encouraging them
Right.
to be as healthy as they possibly can. There's no difference in me encouraging you to get lab work done if you're going to have some type of an anabolic in you, as there is for a doctor to say, listen, you should take a cholesterol medication if you're going to keep eating the McDonald's every day. It's just McDonald's is going to kill you a lot quicker than bodybuilding will. So I feel like I'm doing a much better service. I'm trying to promote health here, as opposed to, I feel like they are just trying to keep people from getting unhealthy. I'm trying to help people get even more healthy. So hopefully it starts changing. There's a few of us out there. I don't know of any other ones in Tennessee right now, but there's got to be other people that are like-minded like me. You know, if you see doctors that are competitors, I think that's a good
I think
sign.
I think I was blessed to walk to no discovery. I ain't gonna say discovery, but show up at the open gym, because like I was stating, you know, I was driving 45, 50 minutes to go and see a doctor who was doing my blood work, and I was thrilled to find out that, you know, you're 5 minutes away from me, you know, and then and I like the fact that I can just call you at any time, and you answer the phone, you know. I think one time I may have called you like 6 something in the morning, and I and I think I lost track as I was in the gym, and you answered. so yeah, so you don't find many people, you know, like yourself, like Coach was saying, you know, that we feel comfortable with, and then when you do find them, you kind of gravitate towards them even more to learn and continue to help others as well. You know, I have a couple of friends who is now going to see Dr. LaPere, and then when I was talking about what happened to me, it kind of made a lot of my friends kind of look like, you know, wide-eyed, like, man, I didn't know you was going through that. And then come to find out, some of them haven't been to the doctor in 5+ years, and they're older than I am. So when I told them my situation, they were immediately trying to get Dr. LaPere's information. And just so happened at the Olympus Expo, Dr. LaPere had a table set up, and some of the guys who were in the gym, I had the opportunity to meet him and get some things set up. I think that whether you're a competitor or not a competitor, you should get your blood work checked at least two times a year outside of your physical, because I think COVID may have thrown a lot of people off. If I had been bodybuilding and I was just doing a yearly physical, I probably would have missed the year that COVID hit. And then now I would have been 2 years behind, you know, and being in the situation that I happen to be in and that I didn't know about, it could have been worse than what it was. So I'm just thankful that God blessed me to still be here, to be a vessel. Thank you, Coach, for allowing us to use your platform to talk about it. And I think we need to talk about this freely and you know, and with courage, and not be fearful of talking about certain things, because you never know if we're going through things that are common with others. And from talking with Tony, you know, I kind of learned some things from him as well, which made me feel even, you know, much better. We were comparing our lab reports.
Right. That's what I wanted to ask too. With the PSI, what is the alarming number or the range? Okay.
So it's age adjusted for that. You know, as we age, that prostate level will start to increase naturally. Every man, if you live long enough, for the most part, is going to develop prostate cancer. It's just one of those things that happens. Most people end up passing away of other natural causes before they
Gotcha.
actually develop the prostate cancer. But, you know, and that's not a hard and fast rule. It's just kind of an adage. But every year that number is going to slowly creep up. People start getting benign prostatic hypertrophy where the prostate just naturally starts to increase. You'll notice when that hits in, because the first sign is that you used to be able to arch a little bit when you pee, and now all of a sudden you can't. You're ending with dribbles. That's a sign that that prostate's getting a little big, squeezing on the urethra a little bit, and the bladder's not strong enough to push past it anymore. So if someone is in that stage and they're 65 years old, their PSA may be at 2 to 3, which is fine. It's fine for that. We just monitor it annually, make sure that it's not going up too much. Me at 45, if my PSA is 3, I'm getting that thing double checked, you know, because you can get infections in the prostate. You can get irritation to the prostate. If you go to the doctor and they do a prostate exam, that can cause your PSA level to artificially go up for a little while. So, you know, if you were riding your bike and you hit the seat wrong because you jumped and fell down on that seat, that could hurt the prostate, artificially raise the prostate specific antigen for a little while, but then you come back in a month, that should have calmed back down. So for a very verbose and long answer to your question, it depends. You know, we look at it based on how old the person is, and then we look at it from what their previous one is. Now that we have a baseline with Napoleon, we know what we're looking at moving forward.
And in my case, I really didn't have no symptoms. I really didn't have any symptoms.
Neither did I.
In my case, you know, my prostate wasn't enlarged. Matter of fact, my urologist stated that my prostate was fairly small. It didn't have any things that you would feel on the outside of it. So, and then when I was getting up to use the bathroom throughout the night, you know, because I drink a lot of water, I was kind of attributing that to that. But like in my case, and some people say that could be scary, especially when you have something and not have any symptoms. Those things do exist. That's why it's very important to get your blood work done. You know, it's very important to get that done. You know, I'm encouraging people to do at least twice a year. You know, outside of your yearly physical. I mean, we spend $200 or $300 on a pair of shoes, especially if you're buying throwback Jordans. You might as well get your blood work
I feel
done.
like you're shooting a shot, man.
Yeah. But yeah, what was you about to say, Tony?
I was just going to say, you know, from a standpoint of relativeness, as the doctor was saying, you know, it is all relative to your last blood work, and that's how they caught mine. I really didn't have any symptoms like you, and it went from a 1 to a 4, and then the next 2 blood work stayed at a 4, and because it had jumped in a single year to that 4 and kind of leveled off, they, from the heredity, you know, my dad passing from it, they asked me if I wanted to do the biopsy. And, you know, I'm paranoid because of what I saw my dad go through. You would never want to see your loved one go through what I saw my dad go through. It was excruciating and drawn out. And he pretty much spent his last days in the hospital in pain. And so I'm thinking about that. For me, I'm wanting to avoid that at all costs.
You've seen it hands-on.
Yeah.
You've seen it hands-on.
And, you know, I've got a deep paranoia of going in the hospital myself because of that. But the avoidance of going through that was bigger, and that made me try to get checked. And whenever they recommended to get the biopsy, I went for it. They told me straight up that I had it, and I go, okay, I'm going to hit it straight on, and we're going to win in the end. And then just like you, Ice, you know, I think it's our calling to be able to share our story.
Yeah.
Because if we could save a life by saying, hey, you go out there and get checked, you know, that's just one life and another gift that's out there in the world that can pay it forward and do the same. Because like the doctor said, you know, pretty much as we age, everyone's going to develop this. It's the second most common cancer amongst men behind skin cancer. And if you have it in your family, it's a higher probability that you're going to have to deal with it sooner rather than later. So I highly recommend you get checked. And if you have heredity issues, you know, don't waste time. Get checked right away.
Nice.
All right. Um, Anybody want to close with anything? By the way, when I told Coach about it, I think Coach got it quiet and was like, okay, and
Right.
was listening.
Yeah, yeah, because it hit me so hard. I'm like, how we went from,
Yeah.
placing where we placed
Right.
in our last show to you, everything's looking good. We ready to start up the next season. Then like Prostate, and I was like, oh shit. I
Yeah.
said that's what I said in my head, but I was like, it was important, and I heard in your voice how important it was to tell me about it, and for us to just to figure it out and how we was going to get over it. And you asked me, have I been praying lately? And I said, you know what, I haven't. You said, okay. So when we get off this phone, I need you to say one. And
Yeah.
and
Amen.
that's just how it went.
Yep. And I was like, well, I said, man, this might be a sign for you as well to, to strengthen your relationship, your relationship with God as well. So,
Mm-hmm.
but man, like Coach stated, this was the best off season I've ever had. I think my body fat percentage was like 9%.
True.
And
It was
and
so
I was
true.
about to go into prep. So,
Right, right.
yeah, it was going to be a little different, but God had different plans. I embraced that wholeheartedly. I'm happy and thankful that I'm 100% healthy, and I'm going to continue to do those things and monitor and work closely with Dr. LaPere and also bring in some other people as well to get screened. Again, thank you, Coach. Thank you, Tony. Thank you, Dr. LaPere, for coming on and sharing, and Dr. Pierce, especially your expertise. We will be seeing you again soon, Dr. LaPere.
Yeah, Doc.
After I get off, I'm going to talk to more people and also send your information over to them as well, because I think that this live here is going to reach a lot of people to get screened and also learn what your relatives have passed on from. Those are some conversations that we don't have.
Right, right.
And that's how you can kind of find out what's in your family tree. I just happened to find out after the fact that prostate cancer runs in my family on my mother's side, not on my father's side. So, but it's very important. If you know things early on, then you can kind of start being prepared or looking out for those things. Getting your blood work checked and what have you. You don't have to be a competitor to do those things. Nowadays,
Right.
life is short. Take advantage. We only get one body, so that we got to treat it the best way we can and not fill it with McDonald's, like Dr. LaPere was saying, and how that destroys us
100%.
faster than anything. It tastes good, but it ain't doing your body good. So
Right, right.
I'm thankful. But anybody else want to give any closing remarks before we get off?
Nah, it's all good. Thank you so much for your time, Doc. Thank you. Definitely gonna be DM you some stuff, because like I said, it's hard to find doctors like who understand us as bodybuilders and who have the passion for it too. So definitely gonna be reaching out. So thank you.
Dr. P, you want to show your contact
You're
information
welcome.
of how they can reach your office or anything like that, or you want them to go to your page? You can give them your page as well.
Sure. Y'all can follow me at the Refinery Medical on Instagram. And then the phone number to the office is 629-772-4676. We've also got a website, which is my wife's going to kill me for that one. therefinerymedical.com. But, we usually can get patients in within a day or two. We've been around for about 9 months, like I said, but we usually are able to squeeze people in. If you've got something coming up immediate, I have it happen all the time, where someone will be going out of town. They need just a quick IV to boost their immune system or something. So my wife is my office manager. One of our best friends is our tech. So we're a family-run business. We're very passionate about what we do here. We stay late when we need to. As you have seen, Napoleon, we answer the phone whenever our patients call. So I just appreciate y'all giving me some time to stand on this platform.
Skip here. You want to see them? But come on up. Come here. Hold on.
Thanks a lot, man.
Come here, buddy. Here he is.
He's a big old monster.
He's about 100 pounds.
Wow.
He's about 100 pounds. Came course of 10 months.
Ooh.
Crazy.
Good boy. Well, thank you all. Thank you, Coach.
You're
Thank you,
welcome.
Tony. Thank you, Doctor.
Professional, DM me that question and I'll answer it.
What was that, Coach?
No, I seen somebody ask a question. I told them to DM me the question. I'll answer it.
Oh, okay. All right. I'll
Okay.
talk to y'all later.
Okay, I'm gonna save this and put it on my page.
Okay. All right.
Okay.
All right.
Awesome. Thank y'all.
Thanks,
Y'all
you
have a
guys.
good night.
All right.